Chapter 14, Skeletal System. Let's discuss the functions of the skeletal system. Understanding the roles of different medical professionals is essential for navigating the healthcare system. Let's dive into some distinctions. A physician practices general medicine, diagnosing and treating a wide range of conditions. An osteopathic physician receives additional training in the musculoskeletal system, focusing on how it interacts with and affects the body as a whole. This training enables them to take a more holistic approach to patient care. A chiropractor specializes in the manual manipulation of joints and the spine. Their goal is to restore proper alignment, relieve pain, and improve overall health. Chiropractors often focus on treating musculoskeletal disorders and related nervous system conditions. The term orthopedic is the original and correct spelling, though some people may encounter variations like orthopedic. Both refer to the branch of medicine dealing with the correction of deformities or functional impairments of the musculoskeletal system. Knowing the distinctions between these roles helps in understanding who to consult for specific conditions and treatments. Can you think of situations where you might choose a chiropractor over a physician or vice versa? The skeletal system is fundamental to our body's structure and function. Let's explore its components and key roles. Bones are the framework of the body, providing structure and support. Cartilage is a flexible tissue found in joints, ear, and nose, acting as a cushion and reducing friction between bones. Tendons are strong connective tissues that attach muscles to bones, enabling movement. Ligaments connect bones to other bones, stabilizing joints and limiting excessive movement. The skeletal system provides the structural framework, keeping us upright and giving shape to our body. Vital organs like the brain, heart, and lungs are safeguarded by bones, such as the skull and ribcage. With the help of muscles and tendons, the skeletal system enables locomotion and dexterity. The bone marrow produces red and white blood cells, critical for oxygen transport and immune function. Bones store essential minerals like calcium and phosphorus, releasing them as needed to maintain balance in the body. Bones help remove heavy metals and other toxins from the blood, acting as a reservoir. This intricate system is not just about structure. It plays a crucial role in maintaining overall health and functionality. Can you think of examples where these components work together to perform these functions? Let's take a closer look at the incredible factors that contribute to bone growth and development. Can anyone name some factors that influence how our bones grow and stay healthy? Genetic makeup plays a significant role in determining bone size, shape, and density. A well-balanced diet rich in essential nutrients fuels proper bone development. Regular weight-bearing activities stimulate bone growth and strength. Bones store and release minerals as needed, keeping the body in balance. Key vitamins ensure that bones develop properly and maintain their strength. Hormones like growth hormone and sex hormones regulate bone formation during growth and repair. Let's dive into the fascinating world of bones. Did you know that bones are classified into 4 types based on their shape? Bones are categorized as long, short, flat, and irregular. Now, here's a fun fact. Can anyone guess which type of bone is the most common in the human body? That's correct, long bones. The shaft of a long bone is called the diaphysis. Each end of the bone is known as the epiphysis, which is expanded to provide extra surface area for the attachment of ligaments and tendons. Have you heard of the epiphyseal plate? This is the growth plate in long bones. It's where new bone tissue forms during growth, playing a critical role in bone development. Now, let's talk about the periosteum, the outer layer of the bone. The periosteum protects the bone and anchors its blood supply and nerves. This layer is essential for the bone's overall health and repair. Let's explore some important medical terms related to bones. These terms share a common root, osteo, meaning bone. All of them relate to the formation or destruction of bone tissue. First, let's talk about osteoblasts. An osteoblast is a bone-forming cell. Think of it as a builder, laying down new bone tissue to strengthen and support the skeleton. Now, on the other hand, we have osteoclasts. These are bone-removing cells. They break down old or damaged bone tissue to make way for new growth. Next, we have osteocytes. These are mature bone cells embedded within the bone matrix. They maintain the strength and health of bone tissue by regulating the flow of minerals like calcium and phosphorus. Finally, we come to osteogenesis, which literally means bone creation. This is the process by which new bone tissue is formed, whether during growth, healing, or the body's continuous bone remodeling process. Let's explore some fascinating Latin terms commonly used in bone anatomy. Understanding these terms will help us grasp their meanings and applications in medical terminology. First, we have lacuna, which means lake. In the context of bones, it refers to the small spaces within the bone matrix that house osteocytes, or bone cells. You can think of it as a tiny lake where the bone cells reside, surrounded by the bone matrix. Next is matrix, which translates to womb. This refers to the intercellular substance that surrounds and supports the bone cells, holding them together. The matrix provides structure and stability, just like a womb supports life. Finally, we have cortex, meaning bark. The cortex is the outer covering of bone. It's a dense and protective layer, much like the bark of a tree protects its inner structures. Medical terminology often draws from Greek and Latin roots, providing rich meanings that help us understand the function or appearance of structures in the body. Let's explore a few terms together. First, the term hyaline comes from Greek and means glass. It's often used to describe the smooth, glassy cartilage found at the ends of bones and joints. Next is suture, which originates from Latin and means seam. Sutures are the immovable joints found between the bones of the skull. Then we have symphysis, a Greek term meaning growing together. It describes cartilaginous joints where bones are closely joined, like the pubic symphysis in the pelvis. Finally, the term meniscus comes from the Greek word for crescent. It refers to the crescent-shaped cartilage in the knee that provides cushioning and stability. Let's talk about the importance of memorizing the correct plural forms of medical terms. Unlike in everyday language, simply adding an "s" is not how plurals work in medical terminology. Here are a few key examples. The term syndesmosis refers to the binding together of two bones with ligaments. Its plural is syndesmoses. Next, we have suture. This word describes an area where two bones are joined by a fibrous band. The plural form is sutures. The word gymphosis refers to a joint formed by a nail and peg. Its plural is gymphoses. A perfect example of a gymphosis is the joint between a tooth and its socket. Lastly, meniscus describes the fibrocartilage in the knee. Its plural is menisci. The knee has several menisci: anterior, posterior, lateral, and medial. These structures are vital for knee stability and movement. Let's take a closer look at the concepts of flexion and extension, two fundamental movements of the body. To help visualize these, refer to the figure provided. Flexion is the action of bending a joint, which decreases the angle between two bones. For example, bending your elbow to bring your hand closer to your shoulder is a flexion movement. On the other hand, extension is the action of straightening a joint, increasing the angle between two bones. For instance, straightening your arm out after bending it is an extension. Now, here's a key point. Flexion and extension occur along the coronal plane. This is the vertical plane that divides the body into front and back sections. Next, let's explore two key movement concepts: adduction and abduction. Take a look at the figure to help you visualize these actions. Abduction refers to movement away from the body's midline. For example, when you lift your arm or leg out to the side, you're performing an abduction. In contrast, adduction is the movement toward the body's midline. Think of bringing your arm or leg back down after lifting it to the side. This is adduction. Now let's discuss a key movement concept: rotation. Rotation is defined as turning around on an axis. Take a look at the figure to see how this movement works in our joints. Rotation occurs when a joint or structure moves around a central axis. Picture the wrist or ankle as examples of joints that perform rotational movements. For instance, when you turn your hand to face palm up or palm down, that's rotation at the wrist. So, which joints rotate? The wrist and ankle are prime examples. This type of motion allows for incredible flexibility and functionality in activities like turning a doorknob or adjusting your foot placement while walking. Let's dive into two important body positions and movements, prone and supine, as well as pronation and supination. First, prone. This means lying face down. Imagine lying on your stomach to do a push-up. Now, supine. This is the opposite, lying face up. Think of lying on your back to look up at the stars. Next, let's discuss two related hand movements, pronation and supination. Pronation occurs when you turn your hand so the palm faces down, like when you rest your hands on a table. Supination is the opposite, turning your hand so the palm faces up, as if you're holding a bowl of soup. Now, let's explore the concept of circumduction. What is circumduction? Circumduction is a circular movement of a joint. Picture this as the joint tracing a cone shape in space. This movement combines several motions: flexion, extension, abduction, and adduction, creating a smooth, circular motion. Let's look at the figure to see circumduction in action. Which joints can perform circumduction? Primarily, the hips and shoulders. These are ball and socket joints, allowing a wide range of motion. For example, when you swing your arm in a large circle, like warming up for a throw, that's circumduction of the shoulder joint. Let's dive into the movements of the ankle, inversion and eversion. What is inversion? Inversion is the action of turning your ankle so the sole of your foot faces the opposite foot. Picture this movement as if you're looking at the bottom of your own shoe on the inside edge. What is eversion? Eversion is the opposite movement. It involves turning your ankle so the sole of your foot faces outward, away from the other foot. Think of this as pointing the bottom of your shoe outward, away from your body. Take a moment to study the figure, which demonstrates these movements clearly. Inversion and eversion are crucial for activities that involve ankle mobility and stability, such as walking on uneven surfaces or sports like soccer and basketball. Understanding these motions can also help in identifying and preventing ankle injuries. Now let's explore some key terms and their opposite actions. I'll describe each term, and then we'll reveal its opposite with a simple click. Adduction is the action of moving a body part toward the midline of the body. Now, click to reveal its opposite, abduction, which is the action of moving a body part away from the midline. Extension refers to straightening a joint, such as when you straighten your arm or leg. Click to discover its opposite, flexion, which is the act of bending a joint. Prone means lying face down, as in a resting or recovery position. Click to find its opposite, supine, which means lying face up. Eversion is the act of turning the sole of the foot outward, away from the midline. Click to see its opposite, inversion, which is turning the sole of the foot inward, toward the midline. Let's review the axial and appendicular skeleton. Let's dive into the axial skeleton and its components. This includes the vertebral column, skull, and ribcage. Together, they form the central framework of the body. The vertebral column is divided into 5 regions, each with specific characteristics and functions. Let's identify them and their locations. Cervical region is the uppermost part, supporting the neck and head. Thoracic region is found in the upper back, where the ribs attach. Lumbar region is the lower back, supporting much of the body's weight. Sacral region is located near the pelvis, connecting the spine to the hip bones. This is commonly known as the tailbone and is located at the very base of the vertebral column. The skull is a complex structure made up of 22 bones. These bones are divided into 2 groups, cranial bones and facial bones. There are 8 cranial bones, and their primary function is to protect the brain. The remaining 14 bones form the face and provide structure for features such as the eyes, nose, and mouth. The ribcage is made up of 12 pairs of ribs, the sternum, and the thoracic vertebrae. It serves multiple functions, including protection, support, and facilitation of breathing. The ribs are divided into 3 types: true ribs, false ribs, and floating ribs. The first 7 pairs, which attach directly to the sternum via cartilage. The next 3 pairs, which connect indirectly to the sternum. The last 2 pairs, which do not attach to the sternum at all. Let's focus on the spinal cord and its protection within the vertebral column, along with the role of intervertebral discs in potential spinal abnormalities. The spinal cord runs through the vertebral column, which provides both protection and structural support. The vertebral column acts like a bony shield to safeguard the spinal cord from injury, ensuring the proper transmission of nerve signals between the brain and body. Between each vertebra, intervertebral discs perform vital functions. Cushioning. These discs act as shock absorbers, reducing the impact of movement on the vertebrae. Support. They maintain flexibility in the spine, enabling movement such as bending and twisting. The spine typically has natural curves, but sometimes these curves can become exaggerated or misaligned. Let's explore 3 common forms of abnormal spinal curvature. Scoliosis is a lateral or sideways curvature of the spine, often seen during adolescence. Kyphosis is an excessive outward curve of the thoracic spine, causing a hunched or rounded back. Lordosis is an excessive inward curve of the lumbar spine, often referred to as swayback. We'll focus on some important anatomical terms, their definitions, and how we use their adjective forms in medical contexts. Sacrum. Definition. The sacrum is a segment of the vertebral column, located at the base of the spine. It connects the lumbar vertebrae to the pelvis and plays a critical role in supporting the weight of the upper body. Adjective form. The adjective form of sacrum is sacral. For example, we say sacral nerves to describe nerves in the sacrum region. Spine. Definition. The spine, or vertebral column, serves as the body's central support structure. It protects the spinal cord and provides stability and flexibility for movement. Adjective form. The adjective form of spine is spinal. For instance, we use spinal cord to refer to the cord running through the vertebral column. Thorax. Definition. The thorax is the portion of the trunk located between the abdomen and neck. It houses vital organs such as the heart and lungs, protected by the ribcage. Adjective form. The adjective form of thorax is thoracic. For example, thoracic cavity refers to the chest area where the lungs and heart reside. Let's take a closer look at the structure of the human skull, an essential part of the axial skeleton that protects the brain and supports facial structures. Did you know the human skull is made up of 22 bones? It's a fascinating, intricate structure that combines strength and lightness to protect the brain. The cranium is the portion of the skull that encases the brain. It is formed by several key bones: the frontal bone, parietal bones, occipital bone, temporal bones, sphenoid bone, and ethmoid bone. What holds the cranium together? These bones are joined together by sutures. Sutures are immovable joints, covered on both the inside and outside by a thin layer of connective tissue. They provide the skull with the stability it needs while allowing slight movement during development. Now, let's turn our attention to the facial skeleton, another essential component of the human skull. The facial skeleton is made up of 14 bones. These bones create the structure of our face, providing both form and function. The bones that form the upper jaw are called the maxillary bones. They play a critical role in supporting the upper teeth and forming the roof of the mouth. The mandible is the bone that forms the lower jaw. It is the only movable bone of the skull, enabling us to chew and speak. The vomer bone is a thin, flat bone that separates the nasal cavities, contributing to the nasal septum. Let's dive into the linguistic roots of some key terms related to the skull. Understanding these roots can help you break down and remember complex medical terminology. Parietal. The root word in parietal is pariet, which means wall. This refers to the parietal bone that forms the walls of the cranium. Sphenoid. The root word in sphenoid is sphen, meaning wedge. This bone is aptly named for its wedge-like shape at the base of the skull. Temporalis. The root in temporalis is temper, which translates to side of the head. This term refers to the muscle covering the temporal bone, aiding in chewing. Ethmoid. The root word in ethmoid is edem, meaning sieve. This bone is located at the roof of the nasal cavity and has a sieve-like structure for air passage. Let's explore the shoulder girdle and upper arm, key components of the appendicular skeleton that contribute to structure and function. The shoulder girdle consists of two bones, the clavicle, or collarbone, and the scapula, or shoulder blade. Together, they connect the upper limbs to the axial skeleton. The clavicle serves as a strut, holding the arm away from the trunk, while the scapula provides attachment points for muscles and supports arm movement. The shoulder girdle allows for a wide range of motion, including flexion, extension, abduction, adduction, and rotation of the arm. This mobility is critical for activities such as lifting, pushing, and pulling. The upper arm contains the humerus, the long bone that extends from the shoulder to the elbow. The head of the humerus fits into the glenoid cavity of the scapula, forming the shoulder joint. The humerus has attachment sites for powerful muscles like the deltoid and biceps brachii, which enable arm movement and stability. The coordinated function of the shoulder girdle and upper arm allows for activities requiring strength, precision, and flexibility, whether it's lifting a heavy object or throwing a ball. Let's focus on the pectoral, or shoulder girdle, and its essential role in connecting the axial skeleton to the upper arms. The pectoral girdle consists of two primary bones, the scapulae, shoulder blades, and the clavicles, collarbones. Together, these bones provide a stable yet flexible base for arm movement. The shoulder joint connects the pectoral girdle to the upper limb. This joint is formed by two bones, the humerus, or upper arm bone, and the scapula, specifically its glenoid cavity. The rotator cuff is a group of muscles and tendons that surround the shoulder joint. Its main function is to stabilize the shoulder by keeping the ball of the humerus securely within the socket of the scapula. The humerus is the long bone of the arm, running from the shoulder to the elbow. It plays a crucial role in connecting the upper limb to the pectoral girdle and supporting arm movement. At the elbow, the humerus articulates with two bones in the forearm, the ulna and the radius. These connections allow for a wide range of motion, including flexion, extension, and rotation of the forearm. Flexion of the arm is performed by three key muscles, the biceps brachii, brachialis, and brachioordialis. The biceps brachii is particularly active during lifting motions. The extension of the arm is carried out by the triceps brachii, located on the back of the upper arm. Let's explore the shoulder and elbow joints, two key structures that enable the arm's wide range of motion and functionality. The shoulder joint is a ball and socket joint, known for providing the greatest range of motion in the body. This incredible flexibility allows for movements such as lifting, rotating, and reaching in multiple directions. The elbow joint features two important articulations, each with distinct functions. The hinge joint between the humerus and ulna allows flexion and extension of the elbow. The glotting joint between the humerus and radius permits pronation and supination, enabling the forearm and hand to rotate. A joint capsule and ligaments securely hold these two articulations together, ensuring both stability and mobility. Let's dive into the anatomy of the forearm, wrist, and hand, focusing on their bones and movements. The forearm is made up of two long bones, the ulna and the radius. These bones work together to support a variety of forearm and hand movements. The wrist and hand contain three groups of bones. The carpal bones make up the wrist. The metacarpal bones form the framework of the palm. The phalanges are the bones of the fingers and thumb. The muscles of the forearm enable two critical movements: pronation, which turns the palm downward; supination, which turns the palm upward. Let's explore the key anatomical terms related to the hand, starting with its structural components. The pads of the palm have specific medical names based on their location. The pad near the thumb is called the thenar eminence. The pad near the little finger is the hypothenar eminence. The 14 bones of the fingers are collectively known as the phalanges. Each finger contains 3 phalanges, proximal, middle, and distal, except for the thumb, which has two. The bones in the palm that connect the fingers to the wrist are called metacarpals. The wrist is composed of small bones called carpals. There are 8 carpals arranged in 2 rows, allowing flexibility and strength in the wrist. Let's dive into the pelvic girdle, a crucial structure of the skeletal system that supports and protects vital functions. The pelvic girdle consists of 2 hip bones, also known as the coxal bones. It is anchored to the axial skeleton by strong muscles that connect it to the vertebrae and ribs. The pelvic girdle serves several vital purposes. Supports the axial skeleton, ensuring stability. Transmits body weight through the lower limbs, enabling mobility. Provides attachment points for the lower limbs. Protects internal reproductive organs, as well as the bowel and bladder. Each hip bone is composed of 3 fused bones. The ilium, the broad upper portion. The ischium, the lower posterior part that supports weight when sitting. The pubis, the anterior portion that connects at the pubic symphysis. The male and female pelvic girdles differ significantly to accommodate their unique functions. The female pelvis is broader and shallower, with a larger pelvic inlet and outlet to facilitate childbirth. The male pelvis is narrower and taller, optimized for weight-bearing and stability. Let's explore the structure and function of the hip joint, one of the most powerful and mobile joints in the body. The hip is classified as a ball and socket joint. This design provides a wide range of motion while maintaining stability. The hip joint connects the thigh bone, or femur, to the acetabulum of the hip. The acetabulum is the socket of the hip, and the head of the femur acts as the ball, fitting snugly within this socket. Surrounding the acetabulum is the labrum, a rim of cartilage that plays a critical role in the hip joint's function. It cushions the joint to reduce friction during movement. The labrum also helps to keep the head of the femur securely in place within the socket. The hip joint is supported and moved by 3 powerful muscles, collectively known as the gluteal muscles. The gluteus maximus, which is responsible for extending the thigh. The gluteus medius, which abducts and stabilizes the hip during movement. The gluteus minimus, which works alongside the medius for abduction and rotation. Let's discuss an important concept in medical terminology, forming plurals for anatomical terms. In medical terms, simply adding "-s" does not make a word plural. Instead, specific rules apply based on the word's origin, often derived from Latin or Greek. The singular term ischium refers to the lower posterior portion of the hip bone. Its plural form is ischia. Remember, we don't add "-s" to form the plural. It's a complete word transformation. The singular term ilium refers to the large, wing-shaped bone at the upper and posterior part of the pelvis. Its plural form is ilia. Using the figure, we can clearly see the knee joint and its intricate structures. How many bones form the knee joint? The knee joint is formed by 4 bones. The femur, which is the thigh bone. The tibia, also known as the shin bone. The fibula, a smaller bone running parallel to the tibia. And finally, the patella, commonly called the kneecap. What structures within the knee distribute weight and prevent wear and tear? The menisci 2 crescent-shaped cartilage pads are crucial. These act as shock absorbers, ensuring smooth movement and protecting the joint surfaces from damage. Let's examine the structure of the ankle and foot and explore the key bones involved. Take a look at the figure to see the detailed anatomy of the ankle and foot. The 2 bones of the lower leg are the tibia, which is the larger and weight-bearing bone, and the fibula, which runs parallel to the tibia and provides additional stability. The ankle contains 2 key joints that allow for its movement and stability. The calcaneus, or heel bone, provides the foundation for the back of the foot, which bones in the ankle help bear the body's weight. The tarsal bones distribute weight and provide support for standing and movement, which tarsal bone articulates with the tibia. The talus connects the ankle to the lower leg, allowing smooth motion. The collective bones that form the instep of the foot are the metatarsals. And here's a unique feature of the toes. Which toe doesn't have 3 phalanges? The big toe, also called the hallux, has only 2 phalanges. Let's focus on understanding the correct anatomical order of key terms related to the lower body. Why is this important? It's not just about spelling these terms correctly, but also about knowing where they are located in the body and their relationship to one another. Here's a simple exercise to assist in placing these terms in their correct anatomical order. Start at the top with the pubis, which is part of the pelvic region. Next is the femur, the long bone in the thigh. Moving downward, we find the patella, or kneecap, which protects the knee joint. Below the knee are the tibia and fibula, the 2 bones of the lower leg. The proper anatomical order is pubis, femur, patella, tibia, and fibula. Knowing this order helps you visualize the body's structure and understand how these parts work together for movement and support. Let's work on translating medical terms into common language. This is a critical skill for communicating effectively with patients and those who might not be familiar with medical terminology. As healthcare professionals, we often need to explain terms in a way that patients and laypeople can easily understand. The calcaneus is better known as the heel bone. This bone supports the back of your foot and helps with balance and movement. The talus is commonly called the ankle bone. It plays a key role in connecting your foot to your leg and allowing for motion. The metatarsus refers to the foot bones. These are the long bones in the middle of your foot that support your weight during walking or standing. Being able to translate these terms builds trust with patients and ensures they understand their condition or treatment clearly. Let's discuss the disorders and injuries of the skeleton system. Now let's dive into some common diseases that impact the health of our bones. Understanding these conditions is essential for identifying risks, diagnosing, and educating patients effectively. Who is most at risk for osteoporosis? Women after menopause are particularly at risk due to hormonal changes that affect bone density. Let's take a closer look at the figure showing healthy versus osteoporotic bone. Notice how the osteoporotic bone has a Swiss cheese-like appearance, with holes that weaken its structure. Osteomalacia, often referred to as rickets, is a condition that occurs in children. It is caused by a deficiency in vitamin D, which leads to soft and weak bones. This is a type of bone cancer that commonly occurs around the knee joint. It's most often seen in adolescents and young adults during periods of rapid bone growth. Let's discuss some common and significant diseases that affect the skeletal system. These conditions highlight the importance of bone health and early diagnosis. Osteoporosis results from a loss in bone density. It is more common in women, and its incidence increases with age. This condition makes bones fragile and more susceptible to fractures. Osteomyelitis is an inflammation of bone caused by bacterial infection. This condition can be very painful and often requires antibiotics or surgery for treatment. Osteomalacia, commonly referred to as rickets in children, is caused by a deficiency in vitamin D. It results in soft and weak bones, which can lead to deformities. Achondroplasia is a genetic condition where the long bones stop growing in childhood, leading to short stature. Interestingly, the bones of the axial skeleton, such as the skull and spine, are not affected. Osteogenic sarcoma is the most common malignant bone tumor. It typically occurs around the knee in adolescents and young adults. Osteogenesis imperfecta is a rare genetic disorder, also known as brittle bone disease, results in extremely fragile bones. Even minor injuries can lead to fractures in individuals with this condition. Let's focus on understanding the meanings of common word elements in medical terminology. First, the element plasia means formation. For example, in the term hyperplasia, it refers to the excessive formation of cells or tissues. Next, malacia means abnormal softening. A term like osteomalacia refers to the softening of bones, often due to a vitamin D deficiency. Then, we have oma, which means tumor. You might recognize this in terms like carcinoma, meaning a cancerous tumor. Lastly, penia means deficient or lack of. For instance, leukopenia refers to a deficiency of white blood cells. Understanding these elements makes it easier to decode and define complex medical terms. Let's review and define the different types of bone fractures. Understanding these terms is essential for identifying the nature of fractures and determining the appropriate treatment. Closed fracture is when the bone is broken, but the skin remains intact. It's also known as a simple fracture. Comminuted fracture occurs when the bone is shattered into 3 or more pieces, often from severe trauma. Complete fracture is broken into 2 separate pieces. Compression fracture are commonly seen in the spine. This happens when the bone is crushed or compressed, often due to osteoporosis. Displaced fracture involves the bone fragments being out of alignment, requiring reduction to realign them. Greenstick fracture is seen mostly in children. This is when the bone bends and only partially breaks, resembling a green twig. Hairline fracture is a very thin fracture line that may be hard to detect, often caused by overuse or stress. Impacted fracture occurs when one bone fragment is driven into another, often resulting from falls. Incomplete fracture is only partially broken bone and does not break all the way through. Linear fracture is where the fracture runs parallel to the bone's long axis. Oblique fracture is where the break occurs at an angle across the bone. Open fracture, also known as a compound fracture, is when the bone pierces through the skin, posing a higher risk of infection. Pathologic fracture is caused by weakened bones from diseases such as osteoporosis or cancer, often occurring with minimal trauma. Spiral fracture is where the break spirals around the bone, often caused by twisting forces. Transverse fracture is where the fracture runs straight across the bone, perpendicular to its long axis. Let's discuss the process of bone healing and the steps involved after a fracture occurs. Did you know that bone begins its healing process immediately after it's fractured? On average, it takes about 8 to 12 weeks for a fracture to fully heal, depending on the severity and location of the break. To ensure proper healing, the fractured bone must be protected and immobilized. This is often done using casts, splints, or traction to hold the bone in place during recovery. Healing of fractures occur generally in 4 steps. Initially, a hematoma forms at the fracture site. This happens as blood vessels bleed into the injured area, forming a clot. Next, a soft callus develops, providing temporary stabilization to the fractured bone. Over time, this soft callus transforms into cancellous bone, also known as spongy bone, as the healing progresses. Finally, the spongy bone matures into compact bone, restoring the bone's original strength and structure. Let's discuss different types of fractures and how they're categorized, along with an essential abbreviation you'll encounter often. A closed fracture means the bone is broken, but it does not pierce through the skin. In contrast, an open fracture occurs when a bone edge breaks through the skin, posing a higher risk for infection. In a complete fracture, the bone is broken into at least 2 separate fragments. An incomplete fracture occurs when the break does not extend fully across the bone, leaving it partially intact. A pathologic fracture happens in weakened bones without significant trauma or force, often due to underlying conditions like osteoporosis or cancer. A compression fracture typically occurs in the vertebrae, where trauma causes the bone to compress or crush. And remember, when you see FX, it's shorthand for fracture. Let's explore some common joint disorders and their characteristics. Osteoarthritis is a degenerative joint disease caused by the breakdown of cartilage, leading to pain and stiffness. It is often associated with aging or overuse of joints. Commonly affected areas include the knees, hips, spine, and hands. This condition progresses gradually and is the result of wear and tear on the joints. Rheumatoid arthritis is a chronic autoimmune disorder where the immune system attacks the joints. It causes inflammation, pain, swelling, and can lead to joint deformity. It often begins in smaller joints, like the hands and feet, but can progress to larger joints. Females are more likely to develop this condition than males. Juvenile rheumatoid arthritis, also known as juvenile idiopathic arthritis, occurs in children under the age of 16. It is characterized by joint pain, swelling, fever, and in some cases, rash. While the exact cause is unknown, it is believed to involve an autoimmune response. Early diagnosis and treatment are essential to prevent long-term joint damage. Bursitis is the inflammation of a bursa, a small fluid-filled sac that cushions bones and tendons near joints. It is often caused by repetitive motions or prolonged pressure on a joint, such as in typing, gardening, or sports. Common sites include the shoulders, elbows, hips, and knees. Symptoms include localized pain, swelling, and restricted movement. Let's discuss some common forms of abnormal spinal curvature and their characteristics. Scoliosis is an abnormal lateral curve of the spine, typically in the thoracic region. This condition causes the spine to curve to the side, forming an S or C shape when viewed from the back. It often develops during adolescence and can vary from mild to severe. Kyphosis is an exaggerated thoracic curvature, often referred to as a hunchback. It causes the upper back to round forward, giving the appearance of slouching. It can result from poor posture, osteoporosis, or vertebral fractures. Lordosis is an exaggerated lumbar curve, commonly called swayback. This condition pushes the lower back inward, creating an overly pronounced arch. It can be caused by obesity, pregnancy, or muscle imbalances. These abnormal curvatures can lead to pain, reduced mobility, and postural issues. Early detection and treatment, including physical therapy, braces, or, in severe cases, surgery, can significantly improve outcomes. Let's talk about some common shoulder injuries and their characteristics. A shoulder separation occurs when there is a dislocation of the acromoclavicular joint. This injury is often caused by a fall or direct impact to the shoulder. It can lead to pain, swelling, and limited movement in the affected area. A shoulder dislocation typically happens when the ball of the humerus moves out of the socket. The most common type of dislocation occurs anteriorly, meaning the humerus shifts forward out of the joint. This type of injury may require a medical professional to reposition the joint. Subluxation occurs when the ball of the humerus slips partially out of the socket and then moves back in. Unlike a full dislocation, the joint doesn't completely lose contact, but it can still cause pain, instability, and reduced range of motion. Let's discuss the Coles fracture, a common injury affecting the wrist. The radius, one of the two major bones in the forearm, is the bone broken in a Coles fracture. This type of fracture typically occurs near the distal end of the radius, close to the wrist. A Coles fracture is often diagnosed using an X-ray, which clearly shows the location and severity of the break. This injury usually happens when someone falls on an outstretched hand, which places stress on the wrist and leads to the fracture. Now let's focus on conditions that can affect the pelvic and sacroiliac areas. Sacroiliac joint strain is one of the most common causes of lower back pain. The sacroiliac joint serves an essential role. It provides shock absorption for the spine, helping to distribute stress and support the body's movements. In diastasis symphysis pubis, the term diastasis refers to the separation of parts that are normally joined. It's a term often discussed in the context of the pelvis. This condition occurs when the pelvic ligaments stretch, often during pregnancy, leading to separation at the pubic symphysis. Symptoms include pain over the joint, difficulty walking, and trouble climbing stairs or even turning over in bed. Let's explore some key concepts and terms related to foot health and conditions. Podiatry is the healthcare specialty focused on the diagnosis and treatment of disorders and injuries of the foot. It's essential for maintaining mobility and addressing foot-related health concerns. Hallux valgus, or commonly known as a bunion, this is a misalignment of the big toe that can cause pain and discomfort. Pot fracture refers to a fracture of the fibula, located near the ankle. It's a common injury that requires prompt attention. Gout is a condition caused by the buildup of uric acid crystals in the joints, leading to intense pain and inflammation, often in the big toe. Talus equinovarus, also known as clubfoot, is a congenital deformity of the foot that often requires early intervention to correct. Let's break down and understand the root elements and prefixes in these medical terms related to the skeletal and muscular systems. Acromion. The root element is acromi, which means extremity. The acromion is the bony projection on the scapula. Dislocation. The root element is locat, which means place. Is is the prefix, and it means apart. Dislocation refers to a joint being forced out of its normal position. Pectoral. The root element is pector, meaning chest. It pertains to the chest region or muscles. Subluxation. The root element is luxate, which means dislocate. Sub is the prefix, and it means under or below. Subluxation describes a partial dislocation of a joint. Let's discuss the procedures and pharmacology of the skeletal system. Now, let's explore two important diagnostic terms related to joints. Arthroscopy is a term that refers to an X-ray of a joint. It uses a contrast medium to enhance the visibility of the joint structures, making it possible to identify abnormalities like tears or damage to cartilage or ligaments. Arthroscopy is especially useful for diagnosing issues in complex joints like the shoulder, knee, or hip. Arthroscopy means the visual examination of the interior of a joint. Arthroscopy involves inserting a small camera-equipped instrument, called an arthroscope, into the joint through a tiny incision. This allows the physician to diagnose or treat joint problems with minimal invasiveness, such as removing damaged cartilage or repairing ligaments. Let's go over three important medical terms related to joint procedures. Arthrocentesis refers to the withdrawal of fluid from a joint. It's often done to relieve pressure, analyze the fluid for infections, or diagnose joint conditions like arthritis or gout. Arthroscopy is the visual examination of a joint. Using a small camera called an arthroscope, doctors can directly observe the joint's interior. It's minimally invasive and often used to diagnose or treat joint issues, such as repairing a torn ligament. Arthroplasty means surgery to restore function to a joint. Common examples include hip or knee replacements, where damaged joint surfaces are replaced with artificial components to improve mobility and reduce pain. Each of these procedures plays a crucial role in diagnosing, managing, and treating joint conditions. Let's break down some key terms and concepts related to joint treatments. Fluoroscopic injection involves using real-time imaging to guide an injection into a joint or surrounding area. It's often used to temporarily relieve pain, especially for conditions like arthritis or joint inflammation. For stabilization, healthcare providers use braces, and physical therapy stabilize joints. These measures help support the joint, reduce stress on the area, and improve overall function. Arthrodesis is the surgical repair of a joint, often by fusing the bones together. While it eliminates motion in the joint, it's a solution for severe pain or instability when other treatments haven't worked. Each of these treatments serves specific purposes, depending on the condition and the severity of symptoms. When it comes to treating fractures, the ultimate goal is to bring the broken ends of the bone back into alignment. Let's explore the available treatment options. Enclosed reduction. The broken bone is manipulated back into place without the need for surgery. This is typically followed by immobilization with a cast, brace, or splint to allow proper healing. Open reduction and internal fixation is a surgical procedure involving realigning the bone and securing it with plates, screws, or rods. It's often necessary for complex fractures or cases where closed reduction is not sufficient. External fixation is a method where pins or screws are inserted into the bone and attached to an external frame. It provides stability while keeping the bone in proper alignment, especially for severe or compound fractures. Traction is a method that involves applying a steady pulling force to stretch the muscles and ligaments around the fracture. Traction is less common today, but is still used in specific situations. In cases of severe bone loss, a bone graft or stem cell therapy may be used to stimulate new bone growth and repair the fracture. After the bone begins to heal, physical therapy is essential to restore strength, mobility, and function to the affected area. Let's focus on the common root shared by these terms, arthro, which means joint. Understanding this root can help clarify the meaning of these medical terms. Arthrocentesis refers to the withdrawal of fluid from a joint. It's often performed to diagnose or relieve symptoms caused by conditions like arthritis or joint infection. Arthrodesis is the surgical fixation or stiffening of a joint. It's typically used to treat severe joint pain or instability when other treatments are ineffective. Arthroscopy describes an X-ray of a joint using a contrast medium to enhance visibility. It's useful for identifying issues like cartilage tears or ligament injuries. Arthroplasty refers to surgery aimed at restoring joint function. Examples include partial or total joint replacements, such as a hip or knee replacement. Arthroscopy is a minimally invasive procedure for the visual examination of the interior of a joint. Surgeons use a small camera to diagnose and sometimes treat joint problems. Let's explore some of the FDA-approved medications and treatments used for bone and joint disorders. First, let's look at treatments for osteoporosis. The FDA-approved medications for osteoporosis include bisphosphonates, like alendronate or risedronate, denosumab, and teriparatide. These drugs work by either slowing bone loss or stimulating bone formation to improve bone density and reduce fracture risk. Next, let's look at treatments for osteoarthritis. Corticosteroids are used to reduce pain and inflammation, typically injected directly into the joint for quick relief. Viscosupplementation involves the injection of a gel-like liquid directly into the joint. It mimics synovial fluid, helping to lubricate and cushion the joint to reduce pain and improve mobility. Lastly, let's look at treatments for rheumatoid arthritis. Disease-modifying antirheumatic drugs or medications, such as methotrexate, reduce signs and symptoms of rheumatoid arthritis and help slow disease progression. TNF inhibitors are biologics, like adalimumab or etanercept, that slow the destruction of joints by targeting specific inflammatory processes in rheumatoid arthritis. Let's take a moment to talk about abbreviations in medical terminology. Abbreviations serve as shorthand for longer terms, but it's critical to use the correct ones to avoid errors in communication. Let's define some key abbreviations related to bone and joint health. BMD stands for bone mineral density, which measures the strength of bones. DEXA refers to dual energy X-ray absorptiometry, a scan used to assess BMD and diagnose osteoporosis. FDA is the abbreviation for the U.S. Food and Drug Administration, the agency that approves medications and treatments. DJD means degenerative joint disease, another term for osteoarthritis. O stands for osteoarthritis, a condition that causes joint pain and stiffness. TH is short for total hip replacement, a surgical procedure to replace a damaged hip joint. RA stands for rheumatoid arthritis, an autoimmune disorder that causes chronic inflammation of the joints. Always ensure the correct abbreviations are used in medical documentation to avoid misunderstandings and provide clear communication.